Okay, first we are going to discuss the first segment, which is about mood-dependent memory. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Most patients who respond to treatment with antidepressants still experience residual symptoms of depression, such as problems with appetite, sleep, mood, and even suicidal ideation, which can result in significant decline. These symptoms may also increase the patient's risk of relapse into another depressive episode. Mood-dependent memory means memory can be recalled more readily when someone is in the same emotional mood. According to Lewis et al., 2003, motion-specific memory nodes connect many related aspects of an emotion, such as autonomic responses, expressive behaviors, and description of situations that might evoke the emotion. Involvement of amygdala in recall of emotionally valent information provides a functional role for structure retrieval of emotional memories. Siegel, with his two friends, Mark Williams and John Tisdale, undertook a treatment modification called mindfulness-based cognitive therapy. Siegel said that he was not interested in trying to eliminate sadness, he just focused on helping people develop a different relationship to their sadness. In 2006, they also conducted experiments on people who had recovered from depression. The people were induced into a brief state of sadness, and it was found that they could easily recall past experiences of their depression. This therapy was also analyzed by Dimijan et al. In 2014. In a randomized clinical trial of 460 participants, they found that mindful mood balance in conjunction with usual depression care reduced the risk of relapse by 40%. Exercising can reduce symptoms of depression and positively affect brain plasticity. We can train in a simple way independently at home, such as aerobic or resistance training. It turns out that every time someone experiences depression, the connection in the brain between mood, mind, body, and behavior are formed stronger, making it easier to trigger another depression.
The second segment about mindfulness. So mindfulness is really the awareness that comes to mind, the awareness that arises when we pay attention in a particular way. So purposely attending to the present moment without judgment. It can reveal aspects of our experiences that have already been and are continuing to be present for us, but we are just not able to access them. We are not focusing on them. According to the research of Riff and Case in 1995, mindfulness is divided into 6 dimensions. First is the extent to which the individual has quality of positive relationship with others. Next is the individual ability to accept themselves, and then has a purpose in life, and then is able to grow personally, and then is able to control the environment effectively, and lastly become an independent person, or we can say autonomy. But according to the last decade research by Bayer et al. In 2006, mindfulness is divided into 3 main dimensions in adolescence. First, acting with awareness. Second is observing. Third is accepting without judgment. Several studies in America have shown that individuals who have experienced depression or depressive symptoms tends to have low-level mindfulness, as evidenced by the opposite neural activity between depressed individual and individual who have high level of mindfulness. It can be found in a research by Wei et al. In 2010. And then continuing with the research of Alif et al. In 2012, depressive individuals tend to ruminate on themselves in every experience that they felt, and that behavior makes them fall furthermore into depression. And then Zinel Siegel, which is the speaker of the TED Talks, created mindfulness-based cognitive therapy. It is a training program basically for people who have recovered from depression. It featured extensive training in mindfulness meditation, mindfulness movement, and other things that are related or relevant to living with a depressive disorder. This takes the concept of mindfulness. The practice of mindfulness allows you to be focused on directly feeling what you're going through, as well as having and noticing thoughts about the experience as well. Thank you.
Third segment, mindfulness-based cognitive therapy. Mindfulness-based cognitive therapy essentially tries to work starting with concrete examples of how to pay attention and how to be mindful. As first described by Sakha, MBCT consists of 8 consecutive weekly sessions of about 2 hours length. Instruction consists of various formal and informal meditation practices, including guided body scans, sleeping and walking meditations, mindful movement based on Hatha Yoga, 3-minute breathing spaces, and focused awareness on routine daily activities. MBCT was first developed as a strategy for relapse prevention that could be delivered in groups. The rationale for first applying MBCT to relapse prevention lies in the assumption that the repeated associations between depressed mood and catastrophic and despairing thinking that occur during an episode of depression create vulnerability to future episodes of relapse. The present study examines the feasibility of mindfulness-based cognitive therapy and its effectiveness for improving subjective and eudaimonic well-being among community residents. The fourth segment, negative emotions. MBCT tries to get people to anchor themselves in their experience so that when a negative emotion comes up into the mind, it can wash over them. It doesn't totally destabilize them, nor does it necessarily bring it to mind all of the negative associations. Instead, they can find a different place for work of their feelings. Mindfulness-based cognitive therapy has performed very well in clinical randomized trials. 7 studies worldwide show a result that about 1,000 patients have been evaluated using this approach. Compared to usual care, Sakha finds that MBCT reduces relapse by about 43%, and compared to antidepressant medication, it provides equal protection against relapse as continuing on an antidepressant for long periods of time. For patients who are unwilling to continue with AIDs for relapse prevention or would like to taper off medications, MBCT may be offered as viable alternative to ongoing pharmacotherapy.
Section 5. Present Pathway. Health benefits can get lost in the fact that mindfulness also changes the brain. It changes the brain in very meaningful ways by allowing people to access what's being called the present moment pathway. Now, on the face of it, it makes sense. We are training people to pay attention to the present moment, so maybe there are some parts of the brain that can turn up to be able to do this. But we've got some very good data to suggest that part of this present moment pathway. The region that is very active in training mindfulness is in the insula. Mindfulness is a technique that can help us manage this process more effectively by building skills of concentration, attention, and the capacity to direct our awareness in specific ways. This can mean that we are less likely to easily experience wrong emotions controlled by the amygdala. In this sense, when we practice meditation regularly, we build the capacity to become aware of our thoughts and emotions. As our mind becomes calmer, our nervous system is able to acquire more accurate information and can access the capacity for creativity, flexibility, and lateral thinking that allows us to manage challenging situations more skillfully. We now know, based on research into brain development, that regular meditation and mindfulness practice can reduce the size of the amygdala, can reduce levels of stress hormones, and strengthen connections to the frontal lobes, all of which means we tend to live with less stress and more happiness.
Moving on to the next segment, which is the insula. The region that is very active in training in mindfulness is the insula. According to Udin et al. In 2017, deep within the lateral sulcus of the brain is the insular cortex. The insula was first identified by Johann Christian Riehl in 1809. The insula is one of the brain's least understood regions. This is primarily due to its remote location within the brain, which makes it hard to access. According to Gibson in 2019, the insula and surrounding neural circuits are thought to be responsible for various purposes other than interoception. sensory motor, pain, and socio-emotional processes, as well as high-level attention and decision-making, are all functions of the insula. Attention, awareness, and all psychological processes are connected to mindfulness. There is scientific proof that mindfulness and some of its advantages may be best described as increased interoception as an outcome of the neuroplasticity shifts in the insula. Meditation on mindfulness has been shown to stimulate the left anterior insula, which is associated with attention and awareness. The insula allows signals from the body to be more precisely tuned. Those signals are from the present moment. It comes from sensations, the things that are happening in our bodies at the time. It is what we feel, what we hear, and what we see right at that moment. This also improves people's ability to tune into the state of their bodies. Research discovered that as the present moment pathway becomes activated, people who have been trained in mindfulness are able to significantly increase activation in the insula, unlike people who haven't. So, mindfulness trains awareness in this present moment pathway. Awareness in the present moment is critical and vitally important when working with our sad mood states. It helps people recognize and understand their own emotions and also others.
For the last segment, Executive Control Network. People who haven't had training in mindfulness will activate a part of the brain called the executive network. Executive network can also be referred to as executive function or cognitive control. This topic is discussed by scientists in neuropsychology. Versace et al. In 2012 state that executive function is an ability to control and manage cognitive and behavioral processes used in self-regulation in achieving goals. Another definition is stated by Diamond in 2013, who argues that executive function leads to a person's mental process when concentrating, paying attention, doing something, or relying on an instinct or intuition that is not recommended, does not have enough time, or is impossible to do. There are three main components at the core of the executive function, namely inhibitors that include inhibitory control, working memory, and cognitive flexibility. Inhibitory control is an ability a person has to control attention, behavior, thoughts, and/or emotion in order to override external influences or internal tendencies, and take appropriate or needed action. Thus, inhibitory control makes it possible for us to change and for us to choose how we react and how we behave. It can also save us from making fools of ourselves. In addition, executive function also depends on three brain functions, namely working memory, mental flexibility, and self-control. When trained on mindfulness, a person who feels an emotion can access two channels of information, namely about the meaning of the emotion felt and information about the state of the body that responds to the sensation of the existing stimulus. In addition, practicing mindfulness allows one to care for themselves in a way that touches on moments of greater wholeness in their days and allows us to soak in more moments in their lives as they move forward.